Healthcare remains a top priority in Governor Babagana Umar Zulum's 2 years of the second term. The allocation of 15% of the 2024 and 2025 budgets to the sector, coupled with upgraded salary scales for health workers, demonstrates the governor's commitment to the well-being of Borno citizens.
In Professor Babagana Umar Zulum, His Excellency, the Executive Governor of Borno State, CON, FNSE, in him we see a person who is very compassionate. In him, in Professor Babagana Umar Zulum, we see a person who is focused on the healthcare of the citizens of Borno State. It's during his tenure that we have seen free drugs for all the pregnant women. It's during his tenure that we've seen free cesarean section to all the women, and in his program we have seen so many changes in terms of infrastructure, both at primary and secondary level, and now in tertiary level we are seeing the situation where we're about to commission a teaching hospital and a medical school owned by the state government. And I will urge your viewers to be shown the facilities of this, the teaching hospital. And in Professor Babagana Umar Zulum, we're seeing that for the first time in Borno State, the salaries of the staff of, health workforce in Borno State are at par or at the same level with that of the federal government. These are measures to help in recruit and retain staff and making sure that they are comfortable at place of work, and making sure that they are kept up to date, so much so that our staff would stay behind to look after the citizens of Borno State. For that, we're immensely grateful to His Excellency, and words are not enough to say thank you to Your Excellency for what you have been doing in the healthcare sector. We have enjoyed above 15% of the budget allocated to healthcare, and we are seeing a lot of hospitals being built, a lot of primary healthcare centers being built, a lot of primary healthcare centers being renovated, revitalized, and all these are down to the executive governor who has got empathy and who is compassionate for healthcare delivery in Borno State.
Under this administration, the healthcare sector has undergone significant transformation. This progress stems from Governor Zulum's unwavering dedication and the tireless efforts of the Honorable Commissioner for Health, Professor Baba Malam Gana. For years, inadequate facilities and high costs limited citizens access to high-level medical care. This is now changing. A multi-billion naira teaching hospital will commence operations this year. This legacy project will provide cutting-edge healthcare services statewide.
The Kashim Ibrahim University Teaching Hospital, we've gone very far. In fact, you can see this is one of the priorities of His Excellency, the Executive Governor of Borno State, Professor Babagana Zulum. So this has been a very wonderful project for the whole of Borno State. And as I'm talking to you now, we've gone far. We've gone to the level of tiling. We finished tiling the whole of the hospital. We've gone to the level of putting windows and doors and everything. As I'm talking to you now, the hospital is undergoing screening. So very soon, by the end of I think August, we should be able to finish the construction. And I'm also happy to tell you that most of the equipment are on ground. The few that are on their way coming is the radiological equipment. But I can tell you we have almost all the equipment, including laboratory equipment and other basic hospital items. So this building is actually, in fact, this dream is actually a combination of a lot of specialties. So many special, high-level individuals came together and sat down, of course, by the instruction of His Excellency. They came and sat down and came up with this structure. And I can tell you, this is a massive structure. We'll go around and you're going to see it. We got a lot of experiences and information from different places before we put this hospital together. And we're going to have all these specialties that you can think of. We have the pediatrics department is going to be here. There is going to be medicine department with the O&G, the obstetrics and gynecology department, and then the surgical department. And in addition to that, in addition to the clinical aspect of it, we're also going to be training people. We're also going to be training the nurses and the other healthcare workers. And I hope you know that we're also linked to the Kashim Ibrahim University. So there is medical students, which is going to be one of the key aspects of this hospital, producing young doctors. You can see there is a lot of issues with manpower when it comes to health. This syndrome, colloquially they call Japa syndrome. A lot of people have gone out for greener pastures. So the HE, in his wisdom, actually came up with this idea that we need to do something to actually come up with a lot of individuals that can assist us in the medical field. And thank God we have, I think the first and the second year are already in the practice now in the Borno State University. And I think by their fourth year, they will be coming here. And we are going to be producing medical doctors. This is going to go a long way in actually easing the tension, the stress on the Federal University of Maiduguri. So we are going to be producing, and by the time we start producing, we are going to have more medical doctors and nurses. This will go a long way in assisting us. You can see what His Excellency is doing. A lot of primary health centers have come up. A lot of them have been renovated. And then we also have secondary centers in the villages, in the local governments. So we need people that will man these things. And yes, we have a plan. And I can tell you this plan is going to go a long way in helping the health sector.
Secondary care has also received unprecedented attention. New ultra-modern general and specialized hospitals have been constructed across local government areas, including MMC, Jere, Ganzai, Magumeri, Gubio, Dambua, Mafa, Dikwa, Uba, Mongono, and Piu. Existing facilities have been revitalized, remodeled, and re-equipped for efficient service delivery. Notably, specialist facilities like the Biu and Mongono Eye and Dental Hospitals were completed within a single year.
The commissioning of these state-of-the-art hospitals is a significant milestone in our concerted efforts to revitalize the health sector in Borno State. It represents our commitment to providing accessible, affordable, and quality healthcare services to our citizens. I have no doubt that these hospitals are designed and equipped with modern facilities and staffed by highly trained medical professionals to meet the healthcare requirements of this densely populated zone, thereby reducing the need for referrals to the state capital or outside the state. Healthcare is one of the cardinal pillars of the Borno State 25-year development plan and the 10-year strategic transformation initiative. Reflecting on this commitment, we allocated 15% of the state budget to health sector.
This program,
Your Excellency, sir,
funded by Nora.
Borno State is the only state in Nigeria which has got a dental hospital and eye hospital in every senatorial zone. We are immensely grateful to Your Excellency for this vision, and we are here fully to ensure that this is facilitated. These facilities are specialist health facilities that can handle advanced ophthalmological and dental cases with capacity to cater for patients well beyond view. Sight is life, Your Excellency. We appreciate you for bringing to the doorsteps here in view to cure the commonest cause of blindness, which is cataract. People in this region will no longer have to travel for hundreds of kilometers to undergo cataract surgery. The dental hospital is equally important Provision of dental hospitals in every senatorial zone is another record by His Excellency, for which we are immensely grateful.
All the idea behind the establishment of this hospital is to decentralize and bring healthcare service closer to the communities that need it most. Before, we only have one eye hospital in Maiduguri and one dental hospital in Maiduguri. But His Excellency, in his wisdom, feel that at least the communities needs to have these services as close as possible to where they are. So that's what informed the decision for him to give the approval for the establishment of this eye and dental hospital in Biu and that of Monguno that is coming up soon.
The critical shortage of health workers, a nationwide challenge, is being proactively addressed. Governor Zulum's administration has constructed College of Nursing and Midwifery in Goza and Monguno. This initiative makes Borno the first Nigerian state with such college in every senatorial district, ensuring a sustainable pipeline of qualified professionals.
Human resource in health challenge will cease to exist with the establishment of the College of Medical Sciences in Borno State University, the Borno State University Teaching Hospital, College of Nursing and Midwifery in Monguno and other parts of the state. The challenges of health infrastructure have been squarely addressed with the construction of several new ultra-modern and specialized hospitals in Biu, Monguno, Mapa, Magumeri, Gubio, Dikwa, Uba, and other communities. Health facilities destroyed by insurgency have already been reconstructed, rehabilitated, and re-equipped.
In 2023, the Zulum administration established the Borno State Drugs and Medical Consumables Management Agency, bringing transparency and safety to pharmaceutical management. Under pharmacist Abdul Karim Umar, the agency achieved remarkable progress within its first year.
The agency, Borno State Drugs and Medical Consumables Management Agency, was signed or assented into law by His Excellency Professor Babagana Umara Zulum, CON, MNI, FNSE, FNIAE, on the 6th of September 2023. And then one of the major cardinal principles of signing this agency into law is in line with the National Distribution Guideline, which says that majorly each state should have a drug management agency. Their major function is provision of qualitative and affordable drugs for Borno State indigenous. When we came into agency to pilot the affairs of the agency, I want you to know one thing is we are being governed. You know, we have a governance structure, which is called at the CMT. This governance structure is being championed or piloted by the minister under the Honorable Commissioner of Affairs, Professor Baba Malam Gana. He brought the complete team to strategize, to move the Central America into a new drug management agency to fall within the stipulated guidelines. The Honorable Commissioner of Health, who happens to be at the head of the governance structure, Professor Malam Gana, also once again to strategize to make sure that we have a new pharma grade warehouse. We now change or digress from the existing store that we had, which was not in a very good condition. I will not use the actual, but it was not in a very good condition, but now it has been upgraded to a pharma grade standard with all the quality that's needed to have in a very good warehouse, in the pharma grade standard, which is in line with the WHO guidelines. In the warehouse now, the walls of the warehouse are being insulated, both wall, ceiling and top, to maintain the ambient temperature within the warehouse. There we have chillers inside the store. These are responsible for providing the cooling condition of the warehouse, which is also what is needed for a pharma grade warehouse. For maintaining a standard temperature within the warehouse, which is between 2 to 6 degrees, now that temperature of the warehouse has become a very good storage warehouse. It gives an ambient temperature for all drugs and consumables within the state. So by doing that now, you are going to have your drugs in a very good qualitative form. You know, heat reduces the activities of some of them. It affects the quality of our dog. But I want to assure you now that we have one of the, if not the best, one of the best warehouse in the country. So this is one of the steps that we have taken. We have upgraded our warehouse, which is one of the major achievements for the dog management agencies. According to National Public Supply Chain Management from Federal Ministry of Health, after assessment, we were found worthy to not only keep essential medicines in our store, to also keep integration or to participate in integration of public health commodities like malaria drugs, like HIV drugs, TB, MNCH commodities. So these are some of the achievements that have been done in the warehouse. One of the other things that has also been achieved in the warehouse, in the drug management agency is one, His Excellency, because of the upgrade of warehouse, the standard warehouse we have, His Excellency approved for the drug management agency now to upgrade and continue the distribution free maternal drugs, which is a program His Excellency Professor Wagana Omar Zulum has championed to support our pregnant women, so that we reduce that menace or burden of maternal mortality that has affected the state, which when you look at indices that Borno State falls among those few states that have difficult issue of maternal mortality, which the Economic Commission has been championing and piloting this thing.
Further innovations include the rollout of electronic health records (EHR), spearheaded by Commissioner Professor Ghana and supported by UNICEF. Pilot digitization projects are already complete at the State Specialist Hospital and 1,000 housing estate facility, marking a major step towards modernized healthcare systems.
The digitizing of hospitals is crucial in the modern context of healthcare, and this by global international best practice. This is what happens in most developed countries and even medium to low income countries of the world, where processes within hospitals are digitized, and therefore it brings about efficiency and also brings about improved patient care. And that is what led us here in Borno State to look into this, and we were able to commence the digitization of our healthcare facilities in Borno State. We have looked into digitizing of a primary healthcare center, which is called 1000 Estate Primary Healthcare Center. You're welcome to visit the health center and see for yourselves how it has impacted on healthcare within that facility. And we are also currently digitizing the State Specialist Hospital. It's a massive healthcare facility, and we have picked up certain departments to digitize and demonstrate what it means to have a digitized system, so that the staff in the hospitals and beyond will recognize the importance of digitization, and therefore then we can go into phase 2, where we can expand the process.
The record unit, before we are capturing the data in a paper system, but now we are on computer system. Before we are using paper and pen, and we are suffering because there are a lot of job here. We are tracing, we are doing filing, then we are also registering new patients. But for now, only for registration in the computer system. We are just doing it inside computer. When the patient comes for follow-up, we are going to just put the card number of that patient inside the computer. Then the computer will only bring that information of that person inside the computer, and when we'll send it directly from the record unit to triage. But before, if the patient comes, either for follow-up or new registration, if for the patient is come for the visit for follow-up, we are going to collect that card, then we are going to trace it, we are going to use the number one by one. Even if we didn't get the number exactly, we are going to use one by one.
Governor Zulum personally attended and supervised the groundbreaking ceremony for the construction of a large orthopedic hospital here in Maiduguri Metropolis. This is to address a long-standing problem in this crucial sector of healthcare.
Hitherto, Borno State has no orthopedic hospital. As the commissioner said, people normally used to go to Kano for orthopedic medical attention. However, Maiduguri is increasingly growing in terms of population. You need to have an orthopedic hospital. The Metropolitan Council of Maiduguri, Borno State, need not to be overemphasized. Inshallah, we shall plug up the construction of this orthopedic hospital. Spectrum Nigeria Engineering Limited is well known for their capacities, and therefore we believe that this project will be completed on time. What is the completion period? 6 months? 6 months is quite soon. 18 months, but 18 months is not real. We want it to be completed in 12 months. 1 year is okay. I think we shall release funds as needed. Yes. And I believe the other old site that we left, close to Chad Basin, the Ministry of Health should immediately commissioner, the Chief Medical Director, work and see how we shall establish a medical diagnostic center. We don't have one in Borno State. Should in case our MRI facilities and other facilities in general hospital and teaching hospitals have experienced some defaults, then the diagnostic hospital center will provide the needed services, and it should be, run through a private-public partnership. So look into it. Let's have one drawing. Maybe in the States, in Nigeria, we can see one facilities, copy it and then establish it. Yes. On this note, it is my singular honor and privilege to plug up the construction. Check one.
This milestone event of flagging off of orthopedic hospital in Maiduguri, Your Excellency, you may wish to recall that the nearest, until recently, the nearest orthopedic hospital is in Dala, Kano, which is over 550 kilometers away. And someone who has got broken bones, for him to be transported or her to be transported on a bumpy road is really a tall order. And that is why, Your Excellency, you graciously agreed to flag off the building, the construction of this edifice. And Your Excellency may recall that about 4 weeks ago, you have indeed handed over Azare Hospital in our local government area to the federal government as a federal orthopedic hospital. And this will go a long way for the teeming nearly 7 million people of Borno State. And as a matter of fact, with the insurgency, broken bones have actually multiplied. Your Excellency, this hospital, upon completion, will be a state-of-the-art hospital, and it will also become a training center, sir.
This project will make history. Consider its importance and the ambitious time frame set for its completion. The people of the state, leaders, and other stakeholders have heartily commended the governor for his effort and dedication towards improving the healthcare of Borno State's citizens.
I think we are really blessed to have a leader who is focused, to have a leader who has sense of responsibility, to have a leader who has the common man at heart.
Your Excellency, as I rightly pointed out, you have done extremely well to our people, and yet you are here for another one to come.